It talked about how when we eat something, either very positive or very negative, it either adds or subtracts a certain amount of time from our life. And I was reading this, and then at the end, it blew my mind because they talked about eating a hot dog. All right. Have you ever stumbled upon this information? Because I saw it in one place one time. Okay.
I I saw something like this somewhere where is it, you
Okay.
eat this and you lose so many minutes. Yeah.
You no, you lose per hot dog 35 seconds per hot dog. Now, that doesn't sound like a lot, but I thought back to when I was a kid. I was a hot dog junkie. I had to have eaten thousands of these things. And I'm thinking to myself, 35 seconds, how many hot dogs, how many, I think it was like 50 days of my life had been taken, were gone as a consequence of my eating hot dogs. And how many other stupid things had I eaten along the way? But the good news is for every positive ingestion of food, good stuff, like a portion of broccoli or some salmon, that kind of stuff, you add a similar number of seconds. So every time you eat a meal, there's a positive, negative effect going on in the moment of longevity, which I think is an incredibly powerful thought to have in your head.
Hello, Dr. Glauberman. You are a clinical psychologist and the founder of Lifestyle Intelligence. So welcome to Modern Healthspan and thank you so much for joining us today.
My pleasure.
So,
Good,
Dr.
good to be here.
Glauberman, can you give us some background on your work as a clinical psychologist?
Okay. Uh, Most of the time, I do traditional clinical work. I have a private practice. I deal with people's issues that everybody has to deal with, family issues, interpersonal issues, how to feel better about yourself, become, how to deal with phobias, how to do all kinds of things. And one of those things has to do with lifestyle, because everything tends to drift back into that theme. It's like, how do you make changes in your life? How did you get to where you are? Do you have an understanding of how your problem developed? Okay. And when it comes to things that are having to do with lifestyle and longevity, it becomes a little bit more complicated, but simultaneously easy to understand. It's easy to understand what needs to be done. It's difficult to kind of execute what you need to do consistently because people are really good at starting things. It's sustaining things that are really important. I mean, at this point in time, how many people don't know that it's important to get enough sleep, eat healthy, and exercise? I mean, those three things were the three items we were born with, which is something people don't realize or don't think about. Let's pause for a moment. Think about we're born. We are now human beings. What do we do? Okay, there are three things in terms of sensory information that actually function as our cognition as infants, right? Sensation was cognition when we're born. And the three primary sensations were I'm hungry, I'm tired, I need to move. Eating, sleeping, and moving. Sound familiar? The same things we need to change and be in control of today. We were born with a complete understanding of what they were because that was what constituted what was inside our minds, our cognitions. I'm hungry. I need to move. I'm tired. An infant doesn't say to themselves, I'm going to overeat today. No, they stop eating when they're full. But slowly over time, during, shall we call it the family trance states and the cultural trance states, we get confused as to when we're tired, when we're hungry, when we need to move. And everything that happens right now in our culture as people try to come to terms with that is dealing with these very basic issues that they understood from birth, but somehow environmental, basically family, and then the broader issue of culture, seduced them or hypnotically changed them out of the knowledge that they were born with. And now most people are trying to regain it. How do I get control over these three core elements? That's lifestyle intelligence right there. If you understand that, the quality of your life is going to be better.
Would you say that those are the basics? Because you said you deal with a lot of other psychological issues.
Sure. You got There's family related issues, there's anger issues, there's all kinds of stuff that everybody knows about and is talking about all the time. But these are typically part of what people have to deal with. I mean, families can be a little bit crazy and create all kinds of problems for people. And after a while, you get used to what's going on. So you have amnesia for origins and you just get stuck with the results of what happened way back. And then you're trying to deal with what's going on. That's why people who are really good using hypnosis, there's a technique where you get people to experience the feeling that they're having and then you have them imagine that that feeling is taking them back in time to the origins. And you will frequently find that things are always between like 8 and 12. Something happened, and then it had a life of its own from there. And the individual forgot exactly what the origins were. But when you begin to have knowledge about that particular sequence, you have more control over what's going on. Information is useful. Connections are useful. Therapy is a lot of that kind of thing. What happened then? Let me see if I can alter that pattern inside of me in the now so I can have more control over my life and feel better about myself.
As you say, we should know, well, we do know what we're meant to do. And in fact, doctors have been saying for decades, eat less, move more. So why do smart, motivated people find it so difficult to follow this protocol or regimen?
Because the issues that they're having for the moment tend to supersede the knowledge that they possess about what they should be doing. So they get confused and stopping and starting and stopping. That's why think about how many different ways there have been to lose weight, how many different programs, how many things people are selling. Do this, do this, do this. And at this moment in time, the culture has actually given up on that. And now weight gain is a disease. It used to be behavior, isn't it? I mean, it's really strange to think about weight gain as a disease. And like all of a sudden, this disease over the last 20 years, we have this epidemic of obesity as if you can catch it. Because if you call something an epidemic, it's something you catch, right? But you don't catch it in the same kind of way. You psychologically adjust in a bad way to try to manage your issues. But now we've got an extra layer on top. And that's the inactivity caused by hypnotic trance states caused by digital devices. The culture is in a trance state most of the time. People are walking down the street looking at the screen and then what they're going to do next. Or they're at home, right? When they should be thinking about, okay, when's the next time I'm going to exercise? And no, all of those things tend to get pushed back. And even the everyday stuff. And I can tell you from my own experience about how everyday stuff can profoundly affect you without you having any understanding of it. And for me, it went back to my wife and I, back when we first got married, which was a long time ago in 1969. We moved to California. Okay. Now, I have lived in Long Island, grew up in the suburbs, went to school, walked around a lot. Everything was in movement. You played a lot of sports, you were outside. I was not in shape, but I wasn't fat. I was soft. Okay. We go to California. What do you do in California? In Los Angeles? You drive. So every place I had to go, I drove. 1 year, After we were there, a friend from high school called me up and he said, "Hey, Lloyd, and mentions his name. Um, I said, "Hey, Randy, how are you?" He said, "I'm here in Los Angeles. I thought I'd check in with you." I said, "Great, come to dinner." Comes to the house, rings the doorbell. I open the door. First thing out of his mouth. You ready for this? Man, did you gain weight? All of that occurred completely unbeknownst to me because driving a car, not moving around like I used to move around, I incrementally put on 20 pounds over a period of a year. And without any knowledge of it happening, because it happened so slowly, I got used to the changes in my face. And suddenly I realized, oh my goodness, that guy in that 20-second period of time affected me, other than my wife, more than any other human being I have ever encountered. Because the one thing I wanted to do was never be embarrassed again. So I got interested in all these things that we are talking about, but it didn't come out of intellectual curiosity and knowledge gaining. It came out of vanity. I never wanted to experience that level of insult and embarrassment again. So that was the beginning of my career in what we're talking about right now. I suddenly was a fat guy and had to deal with it.
That's what friends are for.
Oh, absolutely. And he probably would have no idea that he had any impact on me whatsoever because we ate dinner. I never saw him again the rest of my life. Right?
So there was one thing you said, hypnotic trance states. Could you
Mhm.
explain what these are?
I'm generalizing this to everyday events that because of the magnitude and the frequency with which they occur, they fall outside the boundaries of consciousness. So you don't know that certain things are taking place. And I'm sort of generalizing that to a hypnotic trance state because it functions the same way. Like families. Families sit around a dinner table, right? A whole bunch of stuff is learned while you sit around the dinner table. What you should eat, how much you should eat, when you should eat, right? That's what the family does. It teaches you how to go about doing these things. And after a while, because it occurs so frequently, and because parents know what they want from their kids, which is to model what they do. Have you ever walked behind a family and noticed that the little girl is exactly the same shape as her mom as they walk along, and they even walk with the same pace? If they look the same, their size is different. How did that happen? You can say, well, I mean, it's genetics, right? No, it's not genetics. It's modeling behavior unconsciously. And because it happens so often, you incorporate it and you become exactly what your mom programmed you to do with neither of you knowing that any of this was taking place ever. Because I know looking back on my mom was a wonderful mom, but a traditional mom. She cooked, she cleaned, she stayed home, she took care of the kids. So her cooking, my eating was really important to her. So every time I would come into the house after school, she said, "What would you like for a snack?" I was never hungry then. I had eaten 3 hours before. Who's hungry 3 hours later? But I always said, "Oh, I'll have a salami sandwich." Okay. I would eat dinner 3 hours later. My mom loved to see me eat. And when that stopped, when I got older and took charge of what I looked like, changed my eating, my mom got angry at me because I wasn't doing any of the things that allowed her to feel like a mom anymore. But hey, what am I going to do? Eat when I don't want to eat to make my mom happy? Not anymore. But a lot of people still do that. All of that early learning, especially early learning, stays for a long time unless you pause and start thinking about it differently, which is what you and I are talking about right now. Probably everybody who's listening right now and watching right now, they just reviewed in their head their own family and thought about the way the dinner table was set up and what they ate and what information was communicated in their lives right now. Because we all learn all of these patterns outside of awareness. Emotional patterns, eating patterns, behavioral patterns. How? We model. I'm expanding the definition of hypnotic trance state to those broader concepts that we all live through, but the consequences of them are similar to what happens when, in a very short period of time, a hypnotist says you're going deeper and deeper, and then the whole informational sort of thing takes place, what you should change. That's what I'm trying to say. Hypnosis is on multiple levels: family, culture, and then, of course, in its more traditional medical, psychological place. That makes sense?
Yes. So do you see that the problem for your patients, your clients, is that they don't understand where they got the modeling from? Or it's that they can't see it, or that they can see it, but they can't change it?
It happens so much and so often that it's not conceptually stored as anything like that. That was just my family. That was just growing up. That was just the way we went about having dinner. They don't think about it at all until right now, as you and I are talking, everybody is reviewing all of these things in their life. And I'll bet you everybody found one thing that said, oh, that's how I ended up doing that. Yeah. But
So,
with a little bit of knowledge, you can begin to shift it around.
so what would trigger someone maybe to come and see you, or to think about this? Is it like, would it be an event like your friend coming and saying, "Oh, you've put on weight," or would it be noticing something like noticing the weight change, or what
It
triggers
would
it?
probably be more traditional. I overeat. I want to be able to stop overeating. So I'm here now because I want you to hypnotize me or teach me how to go about managing this. It's more structured in the moment, less historically based. But if I think something is really important that had happened by the way they talk about what's happening. Like, is this a recent thing? Is it suddenly you're experiencing way more anxiety than you typically have experienced before, and you're trying to manage it through eating? Okay, we'll spend a little bit more time in the now to try to figure out, okay, what what's causing the anxiety? How can we deal with that? Because if we can deal with that better, then it's much more likely that you're going to manage what you eat better. So it can be a combination of those two things or one or the other. So, but obviously it's up to what structure is presented to me or any clinician at the moment.
And do you solve it by kind of looking forward at how they should behave, or do you try to determine where the programming came from to change it from looking backwards?
Both. Going back and taking a look from a distance is a good thing because if you're not in the experience, you don't have the intensity of the experience. So you want to take somebody back in time, but have them watch it on a screen. So if what they learned was negative and caused by difficult emotional states or transactions in the family, then you don't want them in that. Sit in the theater, look at the screen, slowly go back in time and begin to see yourself and your family and the sequence of events that occurred so you can see it from the distance and not get caught up in the emotion. That in and of itself sometimes psychologically can provide somebody with enough distance going forward so that they can handle that emotional state when it takes place. Because when the emotion pops up at other times, immediately they can reference back to the idea of, okay, let me distance this myself. This is obviously that same thing that I worked on in therapy. So it's variations of how you want them to deal with it. Then, of course, you want them to practice new stuff. So you want them to see the changes that they're doing, see them eating differently, seeing them managing those difficult moments in a more productive manner. So it's a whole bunch of different things all baked into one schema to say, okay, here's some ways that we can get you to maneuver your life into a better place. The most important thing to keep in mind is the original problem never goes away completely, but if you manage it better 2/3 of the time, you're going to be successful. Complete success, that doesn't happen. We ain't perfect. So going for perfection, no. So if somebody's doing well and then they say, I had a really bad week, I always tell them that's a good thing. Because now if you can come back from that week and get this thing moving in a positive direction, you know you're one step closer to keeping this thing in a good place most of the time. And that's what life's about, most of the time.
And how do you try to focus people to make these changes?
Well, most of the time they come in with the idea of what they want to do. Right. And then we'll explore further and trying to map everything out and see whether what we can do to add to what they're doing. Because sometimes they'll come in wanting to do one thing and we'll see, well, there are lots of different threads of this going on, right? You're suddenly eating more. Okay, why now? Right? What's more stressful in your life right now? So there might be your job's in jeopardy and your anxiety level's gone up. So you're overeating because of that connection. You're trying to manage this very anxious state because who wouldn't be anxious if suddenly, and especially now because so many people are in that state where they're losing their job or they're unemployed and they have to deal with what is an incredibly difficult set of circumstances. So you try to look at all, you try to broaden the picture so that when somebody starts with something, you can fill in a whole lot of blanks and have them think about what they're dealing with in as much of a global terminology as you can. Okay, this, and this, with this being the core.
And you've talked about a couple of examples where something has happened recently, right?
Mhm.
Where there's stress from work or something like that. Do you get people who begin to notice, oh, I'm 40, I'm 50, and I'm putting on weight and I really need to try and change, but I'm finding it very difficult.
If somebody's coming in and they're middle age, the first thing I want to do is get a sense of how much knowledge that they have. All right. Because you just brought up something that is incredibly important. And that is if you continue doing, and now we're talking about eating, because that's very simple for everybody to conceptualize. If you eat exactly the same amount of food at 40 that you ate at 20, you're going to be a minimum 20 pounds overweight. Why? Because your metabolism slows down. Now, there are a lot of people who don't realize their metabolism slows down as they age, right? They might have heard little bits and pieces of it, but nobody focuses on it because you can't feel a metabolism slowing. It has no visceral sensation to it. It has a visual sensation to it in that you notice your face getting bigger. You notice there's more weight around your middle. And you're thinking, what's going on? I'm not doing anything differently. So changes have to be conceptual as well as behavioral. You have to remodel your internal diagram of what goes into being healthy as you age. That's such a critical piece of the whole thing, understanding the trajectory of aging and the typical changes that occur so you can deal with them successfully. I mean, how many people that you know are aware of that bit of information? Well, you're in the business of knowledge, but let's face it, lots of people aren't. They're clueless, right? And especially when you use food to help manage your anxiety. Now you're going to have to do something different. Now, exercise would be a great thing to use, but now if you haven't been doing that, now you got to figure out a way how to weave that into your life. And here's the key thing, obviously, sustain it. You've got to keep those changes going. And that's what lifestyle intelligence is all about. Eating, sleeping, and moving, and understanding the ecology of the three and how the ecology of the lifestyle intelligence fits into the larger context of emotional intelligence and intellect. So you've got multiple layers of interaction here. Eating, sleeping, moving, which is one part, which is lifestyle intelligence. Then you have intellectual intelligence, IQ, and emotional intelligence, EQ. The key part of IQ and EQ is if you emotionally regulate the right way by getting enough sleep, which is the linchpin for everything. Because what happens if you don't get enough sleep? Well, you're tired and you're edgy. So your emotional intelligence has been compromised, right? That's that's what happens, right? That's one thing. Edginess, and then, of course, overeating. Hello, weren't we just talking about overeating? Well, if you want to make sure that you're doing the single most important thing to manage food intake, it's making sure you're sleeping enough, which, as we all know, has become that much more difficult in this culture because of those tiny little events, tiny little instruments that we are here we go back to hypnosis now, that hypnotize us all the time into sleeping, going to bed later. And when people go to bed later, that typically means they nibble while they're still awake. So you have all of these things conspiring to make your life that much more difficult. So if there's one thing that I would want somebody to come away with right now, it's the ecological model coupled with sleep being singularly the most important thing we do.
So there is this thought when you're picking a diet, it's you should always think about the diet that I am going to do this for the rest of my life. It should,
Yes,
and that should
no
I,
question.
yeah.
I mean, that's it. The idea is not a diet, a lifestyle change. So if anybody's listening to what you just said, that's the most important thing that has been said as we've been talking. Yeah, that's it in a nutshell. Lifestyle. And we never thought about it as an intelligence before because, well, just like EQ wasn't an intelligence before, it was, which was what, the 1990s? Um, who wrote the book Lifestyle Intelligence? Dan
Gold,
Goleman.
Goldman,
Dan
yeah.
Goleman. Yeah. Who had read a couple of articles by a couple of psychologists in a social psychological journal. Uh, and he read that and said, this is good. Then he wrote the book. He changed intelligence forever because it expanded intelligence into a place where it had to be, right? Our emotions, not just our intellect. So I'm trying to put something out there that offers this kind of shift in perception so that when people begin to include lifestyles and intelligence, it gains a little bit more respect because smart is always better, right?
It is, yes. And you see the three as being interconnected. So nutrition, sleep, and exercise. So if you improve one, then in general, the others will follow.
It's easiest if you start with sleep because it's something you do every night and have to do. And if you get enough, it will ensure that your energy level will be a little bit higher so that when you exercise, you'll have more energy and you're less likely to eat as much because your brain isn't tired asking for more energy. So everything is kind of woven together. But if you start somewhere, it's good. So if you start with exercise, the probability is you'll find sleeper easier to do because you'll be more fatigued. So whatever works for you, start with it. So your point is well taken. Absolutely.
One
Start
thing that,
somewhere. Do something a little
yes,
different.
that is always the thing. It's like the journey of 1,000 steps, of 1,000 miles starts with one step. You have to move in the right direction. So, lifestyle intelligence. So, I think I have some idea of what emotional intelligence is. The ability to remain calm and to understand yourself. So, how would you define lifestyle intelligence?
Well, going back to what we talked about, by the way, emotional intelligence it can be expanded into a whole bunch of stuff
Yeah.
like empathy, anger management, relationships, and the skills that accompany those emotional states. So it's more of that picture. There, everything's kind of intertwined. Like if you manage your emotions better, right, by virtue of taking good care of yourself, your relationships are going to be better. So everything kind of intertwines in ways that uh, people will recognize and are probably thinking about in their own lives right now. Because you can't be listening to the two of us and not be reflecting about how this impacts my life at the moment. What does this mean for me? What can I try to do? I mean, that's why people listen to you because you're well respected in this area. They're not listening just to listen. I mean, they're not watching a television show that they watch every week. This is something that hopefully I'll be able to utilize in my life on a day-to-day basis. Right? I mean, there's nothing more important than that. So you've picked the most important thing to focus on, which is lifestyle, right? About how to shift emotional states and stuff like that.
Can you measure emotional intelligence? Can you measure lifestyle intelligence?
Not in the way that you can measure IQ. It's not going to come out to a number. It's going to come out in the way the situations that you're in are being handled. So if you have an anger management problem and you begin to understand how you developed that and where it typically occurs, and suddenly you find yourself being able to handle those situations differently, that's the evidence for you. The emotional shifts and the behavioral shifts that are a consequence of the internal reorganization of this particular emotional area of your life. That's the way it's figured out. There'll never be a number like IQ. What's your IQ? 120. Okay. Everybody has some sense of what that is. You want at least a three-digit IQ, right? But that's hopefully. But other than that, no. So like emotional intelligence doesn't have that lifestyle likewise. It's all about the behavior and the internal shifts that accompany those shifts.
Right. And you would expect the outcome to be that you would be healthier and have better relationships and better sleep. And
No question.
yeah,
No question. And hopefully you'll get feedback from people. You hopefully while you're doing that and noticing the changes in your own life, somebody says to you, "You look different. You seem a little bit different. What's going on?" That's typically the kind of feedback that you would want. Because if you know that you're handling situations better internally and externally, right? And somebody says you're a little bit different, the probability is they're noticing the positive changes that are happening, but haven't put it in the larger context of emotional intelligence and lifestyle intelligence. Just, wow, you're my friend. You're a little bit different. That's what you'd be looking for, something like that. And you'd say, yeah, I've been going through some changes and reorganizing myself, and I feel better about myself in terms of what I've been doing. So maybe that's what you've been noticing. That's what you would want to hear.
yes. Would you would you suggest that people start with just one change? I mean, in the kind of the atomic habits style, like you decide one thing, okay, I'm going to try and improve that, even though I have many things I could work on.
If that's the best way for them to get it started, yes, because anything that you do in this area is going to be useful, right? Like I said, sleep's the most important part. Okay, but that doesn't mean, as we talked about after that, that exercise wouldn't be something that you can do while you're a little bit sleep deprived. No, that's fine. Or you can start shifting what you're eating, the quality and the quantity. You can do that. Wherever it's easiest for you to get a hold of something and do it well, go for it. Because slowly, if you do that, everything else will begin to sync up in a way that will allow you to slowly to appreciate that triad of experience and how it all comes together. But your point is really well taken. So nobody should think if I don't start sleeping better first, I'm not doing it right. No, go for what's easiest for you to integrate into your life, get it moving, and the probability is the other stuff will follow.
So most of the improvements would probably show outcomes in a long period, right? But you have to make the change now. So how do you get people to sustain motivation over the long term?
You just brought up singularly the most important part of this, sustaining things over time. Nothing is harder because it's so easy to seduce yourself back into a pattern by saying things. What's the big deal? All right, I'm not going to exercise this week, right? I'll have another muffin. What's the big deal? It's only one meal. We have a tremendous capacity to con ourselves, right? So it's really important to realize that that's going to be part of the pattern. It's not about getting there. It's about staying there. And nothing emphasizes that issue more than weight loss. How many people start out New Year's resolution, change things, lose a bunch of weight, and then about 6 weeks, 2 months into it, they start nibbling away at this on multiple levels. And the next thing, life is not about getting there. Life is about staying there. Ask people who have gotten married how difficult it is to stay there, right? It's all about those moments having to do what you know you should be doing at those moments in time you don't feel like doing it. I had to teach myself to ignore the part of me that didn't want to do strength training on certain days. Because I hear that in my head all the time. Lloyd, do you really want to lift those 20-pound weights today? And then there's another part of me that chimes in, and I can't say what I say to myself on the screen right now, but I make sure I do it. But I know from my own experience how easy it is to con ourselves out of doing something after we've been doing it for a while. So your point about sustaining versus beginning is absolutely the most important part of any sequence because you're always going to deal with the part of you that says, I don't want to do this right now. And at that moment in time, you have to figure out a strategy to deal with the part of you who's trying to con you out of doing the constructive thing. Thank you for bringing that up because I forgot to.
But when you're working with your clients, I mean, how do you teach them? Do you have techniques or something that you teach them to help them? Because yes, you do. It's like, oh, it's early morning. I should get up and go for a run, or I should.
Well, there's a couple of things. We talk about what you and I just talked about the normal cognitive pattern of trying to con yourself out of doing something that you didn't really want to do because you had to give up stuff to do it. All those things that it's like alcohol. It's like, okay, I know I shouldn't be drinking so much. And then you stop drinking for a while and then, oh, come on, you can have 2 drinks today. All of that kind of same kind of con. So, one of the things that I have that I provide for my patients is that you and I haven't talked about is I have an audio technology that I provide to my patients to help reinforce everything that we talk about in the session and everything that occurs. And it's right now all of that audio material is part of an app that I have called naturally Lifestyle Intelligence LQ. And it's a way of reinforcing everything about how to impact yourself to make changes and sustain changes while simultaneously having the product relax you deeply and provide an opportunity for you to get into the most interesting state of consciousness that we have, but it's only occurs for seconds every day. Do you know what I'm talking about?
No.
The state in between waking and sleep, the hypnagogic state, the theta state, you know, beta, alpha, theta, delta. Delta sleep, beta is what you and I are in right now, and everybody listening. Alpha is the relaxation meditative state. And then in between, waking and sleep, is theta. If you can hold people in theta, the in between state, they're much more receptive to information. So I figured out a way based on a hypnotic technique that I saw performed in a workshop. It was called the double induction technique or the dual induction technique, where there was a subject and two hypnotists talking simultaneously to the subject. Now, I'm out in the audience and I'm listening to this happening. And while I'm listening, I'm noticing I'm starting to get into this really drowsy, relaxed state. And what happens is the pleasant overload takes you into the state in between waking and sleep. So I figured out a way to come up with a storytelling audio technology to duplicate that hypnotic technique and present listeners with a whole bunch of positive suggestions for being able to change a lot of the same things you and I have been talking about simultaneously while they are going into a relaxed state. So it's a combination stress management tool and behavior change, emotional change, thought pattern change as well. It's an interesting technology. I've had it around for quite a while now. And I'll be glad to send you some material so you can see what I'm talking about. It's really unusual stuff, but very, very useful. And so for my clients as well as people who purchase it on their own, it's a very useful way to help you help yourself because it's subtle, but it's useful.
So, sorry, taking like a step back a little bit,
Mhm.
do you see, I mean, and I'm thinking more about aging, what the role of a mindset and is like the Carol Dweck growth versus fixed mindset. I mean, because a number of people have kind of I guess the fixed mindset with age. It's like, well, I'm getting older, and then naturally these things are going to happen. I'm going to get fatter and so on, or heavier. Do you see that is something that needs to be got over first?
I think people have to understand that it's not inevitable. You simply, without knowing it, allow it to happen. Okay. From my own experience, like I mentioned earlier, I've been on both ends of the continuum. Okay. I have gotten leaner and fitter the older I have gotten. Right. So right now, I don't, I'm don't not do not feel my age in any way, shape, or form. And the one thing I know is we're all more alike than we are different. So if you do the things that you know you should be doing, you're going to find yourself becoming the person you want to be. But you have to take taking care of yourself that seriously. right? It has to be top of line, no negotiation, right? Yeah, every so often, that as we were talking about before, there's that little bit of regression, but you know that that's momentary. And what you do most of the time is take really good care of yourself, eating, sleeping, and moving. I don't negotiate with myself with this stuff, and I haven't for decades. And I know, believe me, I know what it means to be on the other end, as I talked about before. I've been in both places, and we're all more alike than we are different. So I realized, well, if I can do it, anybody can do it. It's a question of choice. And you want to begin to tell yourself that you have choice and you can do it right, but you've got to do it right now.
You do.
How was that for a hypnotic
That
suggestion?
was good.
That was pretty sneaky when I got that in
Yeah.
there, didn't I? Yeah.
Yeah. That made me think of something. Do you do you advise people like what they should do? Like what diet or what exercise, or is it you're helping people with the mindset that they will do something and it's up to them what it is they do.
Well, I mean, we try to stay within the parameters of what health with all like, eating is obviously the one thing where I mean, exercise is exercise, right? You've got to do something. It's up to you. If you want to walk for an hour a day, fine, that's fine. If you want to run, that's fine. If you want to bicycle, there are variations on that theme. But eating, there's certain things that are worth staying away from. So primarily, right, if you have to be a carnivore, all right, minimize the amount of meat that you eat. Come on. And everybody knows what that means. Stop bullshitting yourself, right? Come on. Enough of that. Eat it a little bit, but not most of the time. Take a look at what's advertised on television and avoid anything you see. That should be standard operating procedure. I mean, come on. When you look at a stack of fries the size of your television screen, don't eat this. You know what I mean? I mean, it's like and you look, I know it's interesting. Have you noticed how television has conditioned us and hypnotized us into thinking that overweight is natural and what should happen as you age, right? You see, and I'm not talking about weight commercials where you see overweight people. Every other product has a lot of overweight people in them, middle-aged people. Why is that? Because they want you to think that these people are like you, so it's normal to look like this as you age. That is a visual hypnotic suggestion. So the next time everybody's listening to this who's watching you and me right now, watch the fact that you won't pay any attention to it, but it's there. You'll notice it. That's very powerful. But when you see it as often as you see it, it means it's normal to get bigger as you age. Thank you, television commercials, for doing the single most destructive thing you can do for your audience is reinforce what you don't want to have happen. But we want to sell you our product, so we want you to identify with us. And that's what that's all about. It all boils down to money. It's terrible, but it's true.
I like your rule. If it's on television, if it's advertised on television, don't buy it.
I'm with you all the way. Okay.
It's
Absolutely.
it's such a
Especially food.
yeah, especially food.
Especially food. Yeah,
Yeah, it's such an
absolutely.
interesting rule. Um,
Yeah.
so what are some of the common mistakes that you see people make when they're trying to stick with a protocol?
The hardest part is for people to recognize that as we talked about before, it's not a straight line. It's not like, okay, I'm going to do this and I'm going to succeed right from this point on, I'm going to do it right. No, it's actually very important for people when they learn a pattern to actually have difficulty with it and then rebound, as I mentioned earlier, from that difficulty, pick up again and realize, okay, as long as I do this most of the time, I'm going to be okay. That's what has to be in their head most of the time, right? And as long as they can see, well, we're talking about weight loss. If they can see, okay, since 1st of September, I have lost 10 pounds. Okay, right? 12, what, 6 weeks, I've lost, that's actually a lot of weight for that. But if you consistently see the scale going down, if that's the issue that's most important, whatever it is you're doing, you know you're doing it right. This is not easy. Changing patterns is not easy. So you have to have a larger time frame because all of the excitement at the beginning has nothing to do with the success of what you're trying to do, right? You want to keep that momentum going. And one of the things that people don't think about is let's, because I've seen this happen a lot. Wife wants to lose weight. Wife starts losing weight. Husband starts getting threatened. Wife is losing weight because wife is getting more attractive. And he knows that she will start getting more attention out in the world. And I can't begin to the number of times I have witnessed this from people telling me. I said, "Wow, what's going on now? I mean, you were doing fine, and all of a sudden, and then it's suddenly that husband and saying, no, you don't want to lose too much weight because you might get sick." How many times have people heard stuff like that when they're starting to get in shape from people who are not in shape or from people who think they might lose somebody? All of those things. Never underestimate how insecure people can be. So I tell people that's really important to keep in mind. The people closest to you are not going to like it if you end up succeeding at things they're failing at.
We talked about you start one thing at a time, right? But the idea would be that there would be follow on, right? You'd start off trying to improve your sleep or your eating, and then you move on. Do you have any feeling for how long you should stick to one thing, or and then kind of add things, or do you think it follows naturally in some way?
I think if somebody gets a groove going and they've made a change and they've sustained it and integrated it so it's part of their behavioral patterns now, they're probably going to expand outward and saying, well, if I can do this, what else I can do? And especially that would be my job in terms of therapy to say, you've done really well with this. That means that right now you're probably going to do some other kinds of things. And I always tell them, and probably you're going to surprise yourself by doing it spontaneously, because that happens a lot too. You make a change, and the next thing you know, you feel more confident about yourself. And then in a situation where you would have normally behaved in a particular way, you find yourself behaving differently. I know from my own experience. That's the kind of thing that tends to happen. And you can end up with a totally different model of who you are, which is nice. Because if you change physically a lot, you're different, right? You're different. You every time you look in a mirror, there's a different person looking at you, and you begin to like that person more, and that person begins to do things that are more productive. So there are multiple different kinds of things that happen when you're successful at one. Why not continue the momentum and take really good care of yourself and do some stuff that you hadn't even thought about? Because people are always talking about stuff they want to do, right? Things they thought about doing for years, but have always hesitated or started and stopped or whatever. But life is about evolving, and one should always keep that in mind.
Do you see that people are more aware now of the changes as you get older, and are more willing to try to make the change, make changes in themselves?
I think if you're older, you have the that little bit of background anxiety in the sense of, okay, if you're 70 years old and you're in the process of doing some things, you realize I I'm way past that halfway point at this moment in time. So there's that little bit of additional anxiety, but that doesn't mean that you can't make changes at that moment in time, right? And why not? And add an additional 5 years to your life easily, especially when it comes to health related stuff. If you make your body smaller, yeah, I came across a really interesting piece of information. And I forget where it was located, but it talked about how when we eat something either very positive or very negative, it either adds or subtracts a certain amount of time from our life. And I was reading this, and then at the end, it blew my mind because they talked about eating a hot dog. All right. Have you ever stumbled upon this information? Because I saw it in one place one time. Okay.
I I saw something like this somewhere. Where is it? Yeah,
Okay.
eat this and you lose so many minutes.
You
Yes.
no, you lose per hot dog 35 seconds per hot dog. Now, that doesn't sound like a lot, but I thought back to when I was a kid. I was a hot dog junkie. And I'm thinking to myself, I had to have eaten thousands of these things over the period of because I didn't start getting healthy until I was in my mid 20s. I didn't start paying attention to taking care of myself till then. All right. No, a little bit younger, 23, 24. And I'm thinking to myself, 35 seconds, how many hot dogs, how many, I think it was like 50 days of my life were gone as a consequence of my eating hot dogs. And how many other stupid things had I eaten along the way? But the good news is for every positive ingestion of food, good stuff, like a portion of broccoli or some salmon, that kind of stuff, you add a similar number of seconds. So every time you eat a meal, there's a positive negative effect going on in the moment of longevity, which I think is an incredibly powerful thought to have in your head, which is why I'm speaking very slowly, hypnotizing everybody to remember this simple piece of information. Every time you have a meal, it adds or subtracts a little bit of time from your life. How's that for a closer? Like that? I thought that was
That
pretty good,
is,
quite frankly.
yeah, that is definitely a good way to think about it.
Yeah, yep, yep, yep.
Like every second adds up. Every piece of food you eat adds up.
No question. No question.
So, any final thoughts for people who are struggling with their health behavior change? They know they need to do something, but they can't sustain it.
Well, this is difficult because I have a product and I don't want to like go on the sell right now, but in terms of stuff that they may find useful.
Mm.
Okay. The app that I have offers you 2 free weeks of testing out whether this is useful for you. So you can try this thing out. If it's not something that's useful for you, it doesn't cost you anything. And it's
Okay,
called Lifestyle Intelligence LQ. And it's on the Apple website thing.
right. And Android? Is it Android?
I don't have it on that site, just the Apple site.
It's only on Apple. Okay.
Yeah. Yeah.
One of the ways of kind of changing behavior is cognitive behavioral therapy. So,
Yep. Yep. Yep.
would your technique be kind of the same, different from that?
That's incorporated into anything that I do is what's happening inside your head at this moment in time. What's the thought process? Okay, maybe that just needs to be tweaked, or maybe the thought process is not actually clarifying what is happening behind that, which is a slightly different conversation, which has caused this particular conversation to take place. Like, how do I stop doing this? Well, what was the origins of this to begin with? Right? So it's multiple layered. Neither is all or none. Everything is kind of integrated into an overall way of going about making changes and using different strategies at different times, depending on what the issue is.
Okay. I mean, I would think like summarizing a lot of our discussion, a lot of it is really um, it's paying attention to yourself and paying attention to what you do and realizing where it may have come from, and when it's not serving you well, and trying to figure out, well, how can I do things better?
Well, your point is spot on. And it's very difficult for people to do that more at this moment in time than in any other time in history because the digital distractions that are in their life take up so much of their consciousness and time that there's less time focusing on that more important screen, the one in their head. So say to yourself, okay, let me spend a little bit more time away from that dopey screen that's telling me what somebody just said about somebody else, and spend a little bit more time focusing on the most important person in my life, who is me, and what I should be doing to begin to make those changes I know I should be making. And everybody who just heard me say that, something just went right through their head that said, yeah, oh boy, yeah.
So is that one of the things that I guess one of the techniques that you use in the clinic is restricting screen time?
I bring that up, but I don't have any rules about you can't. Right, I just so certainly when it comes to sleep, it's like, all right, is this important? What's more important? Your mental health, your physical health, or talking to somebody that you don't even know, or maybe you're not even talking, you're sending pictures. Do you really want that to dominate the importance of your brain and body? I can get a little bit edgy from time to time, appropriately so, because I know how important this is. Come on, it's your life and your brain, and you only have one of each.
You do. And
Yeah,
it is so easy to get sucked in to the machine. Okay,
this was
so
fun.
this was fun. So where can people go to find your application? And we kind of talked about it, but what is the
You can
website?
you can you can you can go to the Apple Store and type in Lifestyle Intelligence LQ, and it'll pop up, and there'll be a video of me talking about what the product is and how to use it again, and that's that sort of thing. And then test it out if you want. Download it and test it out, and you'll have the opportunity to do that for a while, enough time so you'll be able to make sense of whether it's useful for you. It'll cover a lot of what I'm talking about now and in all kinds of ways, not just the audio material, but me talking to you every day for 3 minutes, bringing up issues like the ones you and I are talking about right now. So it's got multiple layers and levels, and I really appreciate the fact that you've had me on. Thank you.
Thank you, Dr. Glauberman. It has been great talking to you.